reckless? Is it a threat to the world? The Guardian are reporting apparently 1,200 scientists saying it's an unethical experiment which could allow vaccine-resistant variants to develop. Now, before we went to a break there, I started off by saying scientists, but then I very pointedly actually changed my language to say experts. And the reason I said experts rather than scientists is because, and you are very right to point this out, Paul, and I should have mentioned this before the break, the Mail did an expose on this particular story saying, well, actually, it wasn't really experts. It was actually, there were some scientists on there, it's fair to say, but it also included social workers, midwives, dentists, anyone could sign that document. So there's another element to the story here as well, and it's, of course, the media way of reporting this story. You've got one national newspaper reporting it as experts. You've got another one saying, well, look, it's actually not just experts, it's or scientists, it's other people as well. And I don't know whether that wants to feeds into what you want to say about this, but we can't be locked down anymore. By the way, you can tell me the Queen herself is annoyed about it, and I'd say, sorry, love, sorry, Her Madge. Well, Emma Webb is a social commentator. Dr. Bharat Pankhania is a trusted name when it comes to, well, medical matters, when it comes to virology, when it comes to clinical matters, and he joins me on the line with Emma as well to discuss this. Evening to you both.
Good evening.
Let's start with you, Dr. Bharat Pankhania. We've spoken many times before, you and I. It's always a pleasure to talk to you. And you've always, until now, I think, endorsed responsible and slow unlocking based on, and this is your words that I quote many, many times now on Talk Radio, the fact that the Indian variant is not resistant to the vaccine. It's not going to make people have as bad as symptoms of COVID as we've previously seen. It's not going to have COVID spreaders as dramatically because it makes it less transmissible. So on that basis, based on your previous words, what's the problem then with unlocking on Monday?
So just a little correction, Cristo. It's not less disease causing, it's equivalent disease causing. But by the time the Delta variant had arisen and started to spread, our UK population had already had the vaccines, the older, more vulnerable group. So what we've now got is, one thing is absolutely clear about the Delta variant, which is it is more infectious. It is about 3 to 4 times more infectious. In other words, easier to get infected by it. It's not more disease causing, and it is not bypassing the vaccines. So with regard to Monday, 19th of July, my commentary is as follows. We have all the UK population, if we take into account, about 52% fully immunized. That's very good. There is, of course, the 40-odd, 48% not yet immunized, and we've got to protect people from getting the infection. And people will often say to me, but they all have mild illness, and why are you worried about the younger age group who may get infected? Well, the issue is, the more people that get infected, we will get a small percentage who end up in hospital, and some of them may be severely ill. I appreciate the link has been weakened, not severed, but weakened. And the other thing is the specter of long COVID in people, a post-infection disorder which leaves them with heart, kidneys, brain fog, etc. And we must try and prevent that as much as we can.
Okay, Emma, I'll bring you in here because it's not just about the most vulnerable who've received their double vaccination. And even though, and I think it's about over 80% now have had a single vaccination, maybe even higher, closer to over 90% now have had a single vaccination, we're still going to have people who may get long COVID. We're still going to have young people who will be disproportionately affected by a bad dose of the Delta variant. In fact, I've met someone, I've a friend I had to do a test myself and do all of those sorts of things. I'm negative, thankfully, but I had a friend who I saw a couple of weeks ago who's now come down with the Delta variant. Surely for people like that, Dr. Bharat Pankhania is speaking some sense, and we need to stay locked down.
Well, as you say, so many people have had one dose of the vaccine, and the data suggests that results in 72% protection, especially for the Moderna virus, it seems. What I find a really strange and peculiar argument is this idea that we've told people that they should be vaccinated in order that we're able to ease lockdown. And now we're suggesting that we can't ease lockdown because that will result in vaccine resistant strains because people have been vaccinated. It just seems like a very curious argument to me. And I think, the thing that really worries me, and this is, I'm coming at this from the perspective of somebody who is considering a sort of more holistic viewpoint, not just thinking about the virus itself, but also what Boris has been considering, which is the fact that we're entering into a economic crisis that hasn't been so bad in 300 years. The fact that we have 5 million people in the backlog in the NHS, and the statistics around cancer are absolutely horrifying. It just makes me feel completely sick. And I was looking today at the estimates for cancer deaths before the pandemic, and cancer research showed that there were 450 people die a day in the UK from cancer. That's from statistics from 2016 to 2018. We're now at a point where the last daily statistic for the coronavirus was at 49 deaths. So the vaccine has clearly weakened the link between infections and hospitalizations and deaths. And it seems like the choice to unlock on ballot, choice to not unlock sort of de facto, it's a so-called Freedom Day, because the reality is, because of the way the NHS app is working, people are still going to essentially
Emma,
be in some kind of lockdown.
Respectfully, someone like, and I don't want to put words into your mouth, Dr. Pankhania, but many doctors would argue that it's for the very reason that we have so many people who aren't getting treated for cancer that we need to, the phrase we've heard many times, protect the NHS, because if we don't, well, that number might even get greater because the NHS would become overwhelmed. I can see Dr. Bharat is nodding away with me saying that. What would you say to those people?
Well, can I also just add, I'm not against removal of restrictions. What I am proposing is that there should be a continuation of some restrictions which are at-risk restrictions, which are, for example, the not yet immunized, the schools, nightclubs and places are at-risk places. To have a blanket removal of restrictions plus a blanket removal of infection control measures, that is what I'm concerned about. I'm not saying we need to remain in restrictions ad infinitum. With respect to generating extra cases, in answer to Emma, when you generate lots of new cases, unfortunately, it puts back the investment, the management, the treatment, the attention to all those cancers, the heart disease, the renal disease, the mental health, etc. It pushes back because the arrival of new cases puts pressure on the NHS services. The NHS services have been underfunded for over 20 years, and we need to address this as well simultaneously. And we could do better. We could have spent that money wisely. We spent 22 billion on test and trace, which never worked very well. Some of that investment ought to have gone into NHS services, and I hope money will be made available to increase capacity in the National Health Service, which hasn't been happening for over 20 years.
I mean, Emma, would that satisfy you? Perhaps some sort of halfway house between a full unlock, maybe the most vulnerable and unvaccinated somehow being shielded, nightclubs and some of the areas where perhaps some of these variants might spread more easily, perhaps keeping those closed? What would you say to that?
No, I mean, I don't think so. And strange of me to fall back on Theresa May here, but I think that she made a very good point in Parliament not too long ago when she pointed out that this time last year, the NHS wasn't overwhelmed. We weren't as vaccinated. Well, we weren't a vaccinated population, but yet the restrictions were less than they currently are. And she also made the point, and I think this is a good one, which is that we're going to have to live with COVID. We're going to have variants arise. This is something that we're going to have to live for a long time. And realistically, if we're going to be realistic, we cannot go on like this forever. And just to mention the fact that these scientists you mentioned, well, I say scientists, I did have a look through the list, and you're right that some of the people in there I don't think would really qualify as experts on epidemiology or anything of the sort. But they said that this was an unethical experiment. Well, actually, I agree with them that there is an unethical experiment taking place, but I disagree with them about what that experiment is. And all of these suggestions surrounding vaccine passports, and as you say there, the idea of shielding the unvaccinated, the idea of depriving people further of their civil liberties because of this virus, I think that is the unethical experiment. And I think that is what should be worrying us more than anything. And I think this has gone on for far too long, and we need to get back to a normal way of life as quickly as possible. And I think that I speak for many people in the country who are worried about their businesses collapsing, worried about their lives being destroyed, worried about things that affect their lives that are more than just COVID. We need to return back to a more sensible sense of perspective where we see that society as a whole needs to be viewed holistically, and our health as individuals and as society is not just about this virus. And so I think we should be trying to get back to normal life as quickly as possible.
I mean, Dr. Bharat, you and I have spoken countless times over the last 18 months, and I can't help but feel like now we have got the vaccine and we've been made so many promises as a nation, just for nothing else more than our mental health. Surely a full unlock is now the way forward, and we can always tweak it down the line, or people can make their own personal decisions about how much risk they're prepared to endure.
But Cristo and Emma, I'm not in disagreement with either of you. What I have been saying is when you have this unlock, there are some sensitive places where I feel very uncomfortable about unlocking without proper infection control measures. Nightclubs springs to my mind. Infection control measures on tubes, trains, buses is easy to implement. Why are you not doing it? Secondly, the biggest elephant in the room that you are not addressing is what are you going to do about schools, young children, etc. Because what you are saying with young children is get infected and hope for the best. That's unacceptable, especially when you know you can protect them. You can protect them with investments in ventilation, better air quality, air filters, carbon dioxide monitors, and vaccines. None of these items are being addressed. It's shoved under the carpet. So we are not totally at odds with each other. All I am saying is, in a measured way, restrictions go, but we also have infection control measures going forward whilst we get on top of reducing community infection, especially in the younger age groups, whereby we have not yet got around to immunizing the people.
Okay, I'm going to let you respond to that, Emma. We're just going to keep hold of you both for a moment here on Talk Radio. We'll come back to you both and let you discuss this more. And I'd like to hear from you as well on it. Are you convinced by perhaps a more slow and steady unlock with some of the measures that Dr. Pankhania is talking about? Or do we just go for broke on Monday and start to try and live with this and try to accommodate it in best way that we can? Plus, what are our international responsibilities when it comes to this? Is it right that we're in some way being made to feel potentially guilty for the role that the UK might have in relation to other countries when it comes to this? 0344 499 1000 is the number to call for Talk Radio, which is, of course, now on your TV. You can watch us in all our glory. Go to talkradio.tv for more details, where you can also download our app where you can watch us fully. This is Talk Radio.
Talk Radio, half-hour headlines.
Good evening, I'm Chris Dabbs. The Metropolitan Police officer convicted of the kidnap, rape and murder of Sarah Everard has been sacked by the force. PC Wayne Couzens pleaded guilty to killing the 33-year-old last week. Dismissing him at a misconduct hearing this afternoon, Assistant Commissioner Helen Ball said Couzens betrayed everything we, the police, stand for. The 48-year-old is due to be sentenced in September. It has been announced that nearly 600,000 people in England now have coronavirus, after a 68% increase in infections in the last week, with 1 in 95 people now infected. In Scotland, the figure for the 7 days to July the 10th was 1 in 90, a slight increase from 1 in 100. The Office of National Statistics says the trend in Wales and Northern Ireland is uncertain, with 1 in 360 people testing positive in Wales and 1 in 190 in Northern Ireland. 120 people are now known to have died in some of the worst floods in decades affecting Western Europe. Thousands more remain unaccounted for after record rainfall caused rivers to burst their banks. Oliver Moody is the Times Berlin correspondent and has described the rescue effort.
About 5,000 people deployed by the Disaster Relief Service. The German military, the Bundeswehr, has deployed 500 soldiers, 3 heavily armoured vehicles. There are helicopters winching people from the roofs of buildings and lots of volunteer fire brigades in action. And increasingly people are being evacuated by boat.
10 MPs accepted complimentary tickets for Euro 2020 from betting companies, some of which were worth £3,500 each. Talk Radio's Alex Dibble has more.
8 of the MPs are Conservatives, including Esther McVeigh, the former Work and Pensions Secretary. And they've accepted these tickets as the government considers banning gambling sponsorship from football. Its review of the Gambling Act is also looking at bringing in spending limits for sports betting.
The details appear in the latest register of MPs' financial interests. And now the weather. It will continue to be cloudy across Scotland this evening, with light rain and drizzle moving in from the west. But warm sunshine will continue in England, Wales and Northern Ireland.
Talk Radio is now available to watch 24 hours a day on your mobile and on your smart TV.
Put faces to your favourite voices with Talk Radio TV.
Looking good, sounding even better.
Download the Talk Radio TV app or go to talkradio.tv.
This is Talk Radio.
Across the UK, online, on DAB+, and on the Talk Radio app. Evenings with Cristo.
On Talk Radio.
Thanks for your company. It is Cristo here on Talk Radio with you until 10 o'clock tonight, keeping the seat warm for Kevin O'Sullivan. We're talking about the so-called experts, because actually, in fairness, many of them can't be described as scientists, though the Guardian homepage does describe them as scientists, all saying that it is, frankly, an immoral experiment for us to consider unlocking on Monday. And myself and Emma Webb, the social commentator, Dr. Bharat Pankhania, senior clinical lecturer at the University of Exeter Medical School, have been debating just that this evening. Thanks to you both for staying over the news headlines there. And Emma, I just want to put to you some of the points that Dr. Pankhania was making there. It doesn't sound like we're all a million miles away from each other, in as much as wanting some form of normality to come back on Monday, but where I think we differ is Dr. Pankhania is saying that actually we can't just go for broke with schools. We can't go for broke with nightclubs. There still needs to be some places where we either have some mitigating measures or we perhaps unlock more slowly. Would that be a compromise that's acceptable? I'm kind of thinking maybe not, but you tell me.
I think Dr. Pankhania is being very fair here, and in contrast to many who take a very different line, a very different approach, which is somewhat less fair, I would say. But I think we have to remember that when we look at what happened just before the June the 21st so-called Freedom Day that didn't happen, was that the modelling turned out to be overly pessimistic. They underestimated the effectiveness of the vaccine. They underestimated how voluntarily safety conscious the public would be, and they also underestimated how the positive cases were going to translate into hospitalizations and deaths. So I think that we're being overly cautious, and I think that we Boris Johnson, when he spoke about this not too long ago, said that it's now or never, and he was right when he said that, and he shouldn't have allowed himself to be cowed into backtracking on that. I think that it really is a case of now or never. We can't keep going on like this ad infinitum. I know that isn't what Dr. Pankhania is actually suggesting, but this is the reason why I think that we need to lift the restrictions immediately. Yes, people can take personal responsibility for how much risk they're willing to take on. I think that, everything I think should be entirely voluntary, including the vaccine. I don't think that the public should be coerced into having the vaccine if they don't want it. But I do think that, either the vaccine works or it doesn't. If the vaccine is as effective as the scientists are arguing, the same scientists who are suggesting we should remain in lockdown, it's either one or the other. We've now got to a point where the Office for National Statistics is saying that 9 out of 10 people have antibodies, whether they're vaccinated or not. I think we need to take the risk and pull ourselves up by the bootstraps and get back to normality as quickly as possible. And people should take personal responsibility for the amount of risk that they're willing to take onto themselves.
Is it a fair point to say that we've been somewhat failed here? Because, again, I'm not an expert, I'm not a scientist, I'm just someone very much looking on at this, trying to fathom it like many people. But I can't help but have a feeling, based on what you've just said, Dr. Pankhania, that actually, because we've been so reliant on lockdowns and masks and social distancing and all those things, has the government perhaps been complacent in not bringing in, we've had months to bring in the very kinds of measures that you've been talking about, making sure that classrooms are properly ventilated, making sure that if nightclubs open, that they do so in a way that could be done more responsibly. And it's either been lockdown versus no lockdown seem to be the only two options that the government has been relying on. And same with the NHS, we're talking almost about exactly the same terms as we were 18 months ago, when in actual fact, we have the Nightingale hospitals that weren't used. There surely could have been more measures over the last 18 months that would have meant, had the NHS been potentially under strain, there could have been mitigating factors to stop that happening. I feel like it's either or, and we're back to square one a bit.
Well, let me answer the one about the Nightingale Hospital, and this is really important for our viewers and listeners to know and understand and inwardly digest, because it really is very worrying. The hospitals were built, and somebody made the decision, obviously in the Department of Health and Social Care and elsewhere, to build this hospital costing millions of pounds, but they didn't think it through. We do not have the staff to man these hospitals. So the Nightingale hospitals were produced, but there were no staff to run them safely.
That's
so
staggering, isn't it? I mean, that is just the most staggering thing I've ever heard.
Indeed, but that is as it is. So the Nightingale hospitals were never used, unfortunately, because we haven't got the staff. And we haven't got the staff is a red signal, which is the National Health Service has been starved of nurses, healthcare workers, capacity for a long time, bed capacity. We've been closing wards, we've been closing them and putting them into community care all the time. So those are long-term NHS issues.
But is that something that we could have resolved to a point in the last 18 months? I don't know, offer massive incentives for foreign NHS staff to be able to come, qualified foreign staff to come and work in the UK. Perhaps a fast track programme for student doctors and nurses to have been able to have got up to speed had COVID struck again. I mean, those are just ideas off the top of my head. I'm not paid the big bucks to think of these things, but
we can do better, Cristo. So when the Nightingale hospitals were being set up, I was advocating that these are temporary structures. And instead of temporary structures, I would very much favour permanent structures allocated to different hospitals to improve and increase their bed capacity, and then there would be more people recruited to run it, etc., etc. But it would be a permanent capacity for the hospital to have acquired 50, 100 extra beds, etc. That was never thought of, never considered. Instead, they went for the big bang with the Nightingale hospitals. We have unfortunately been asleep for a very long time, because we knew, for example, that this thing is aerosol spread. But there has been very little attention to detail with regards to going forward, 2021, 19th of July or thereabouts, we need to get out and start living normally. Yeah. What have you done about the ventilation? What have you done about those mitigating factors? Nothing.
I mean, Emma, you must listen to all of this and feel a great sense of frustration that, firstly, the government are seemingly sort of off the hook when it comes to their lack of preparedness for what might come up after July 19th, when they've had the best part of 18 months to do so. But secondly, that commentators like yourself who call for lockdown to end, I've seen some of the stick you get on social media. You're terribly irresponsible, you're an awful person, when in actual fact, again, that's the government being off the hook for that, isn't it?
Yeah, I think that there's a really important point in here to be made, and that is that the NHS should have been more resilient against this. The NHS
not at first.
should.
I get it at first.
Well, no,
we should
have a health system that is able to deal with serious crises like this. And actually, if you look at just the report yesterday about the national food strategy, one of the suggestions in there for why we needed to adopt some of the recommendations was because they said that we needed to protect the NHS from the problems caused by obesity. So again, the narrative is around protecting the NHS from patients. That is not how it should be. And I think everybody would be in agreement that the NHS should be more resilient to deal with these sorts of things. Unfortunately, for decades, it's been the case that the NHS is a very difficult subject to talk about. It's very tetchy. People get very impassioned by it. And so discussing reform and the different ways that might be done hasn't been an easy public conversation to have. And so to some degree, yes, we can't let the government off the hook for the fact that the NHS is in the state that it's in. But also, I think we also have to look to the public and the culture surrounding the NHS, that we need to be willing for the NHS to change so that we don't end up in situations like this. And we need to be aware that this is probably going to be an ongoing narrative, that the NHS somehow needs to be protected from potential patients. I think that is a very, very wrong way of looking at the health service.
Final question to you both. I'll ask it of both of you. We've been talking about these 1,200 people, some experts, some scientists, some who aren't as qualified as perhaps is being reported in some corners of the press. But many of them sharing the idea that we are in some way letting down the rest of the world, that so much of the world looks to the UK, and that we should be considering what the rest of the world might do based on what we do on Monday. To what extent do you think that the decisions we make here in the UK, we should have our example to the rest of the world in our minds when we make those decisions, when our governments make those decisions? Dr. Pankhania, I'll start with you.
So, well, look, the United Kingdom is a G7 country, and it is highly regarded for its good governance and good systems. Where the United Kingdom could do really well, and it has singularly failed, is not with regards to easing of lockdowns and things. It is with its objection to easing of the patent laws on the manufacture of extra vaccines, enabling extra vaccine capacity elsewhere in the world. The United States relented and said, yes, we should do this. The objectors were the EU, the UK, Sweden and Australia, because they have vested interests in pharmaceuticals. Whereas in the middle of a pandemic, if we had enabled the technology transfer and the manufacture of vaccines, extra vaccine manufacturing capacity, the world would be in a better place. And that would be a good example of, we look at the world and we want to look after you.
All right. What do you say to that, Emma, specifically about whether we are letting down the world by unlocking on Monday?
I think the world does look to us in many respects. But I think that's exactly the reason why we should be a role model in this and have the courage to unlock. If you look at countries that have criticised us for this, including New Zealand, with that very argument, New Zealand has had the most draconian approach to coronavirus, with people being arrested and sentenced to, time in prison for hugging people.
A very low death toll as well, though.
Yes, but my point is that New Zealand has done its own thing. New Zealand hasn't been copying the UK. I don't think that many countries are looking to us for our approach. I also think that it's a bit of a weak argument, because ultimately I think that you'll take your position from the position, your opinion on this will be based on the opinion that you already hold. My opinion is that we should we should lead by example by unlocking and having the courage to do so. Others who disagree with me will think that you should model the behavior differently. Ultimately, I think that we should show the world that, you know, it's okay to unlock, and that we should be leading the world by example when it comes to the civil liberties of our citizens by not doing things like France with their health passports and so on. We should be leading an example of how things can be done by taking the courage to open up our economy and get back to normal life as quickly as possible.
All right. Really good to talk to you both. Really enjoyed that discussion as well. The fact that you're not all a million miles away from each other, but it's just the way forward from Monday. Emma Webb, social commentator, Dr. Bharat Pankhania.
Thank you so much for your time, Dr. Bharat.